From the time I was a little girl, I knew I wanted to be a doctor. I remember going to the bookstore with my mom and heading straight to the health section. I was so curious and excited about the human body. I wondered, how do babies grow in a mother's belly? How do the scrapes on my legs go from bloody scabs back to normal skin? Medicine was calling me. The day I got accepted into medical school was one of the best moments of my life. Reciting the Hippocratic Oath was the highest honor and pledge I took so very seriously. The 12 years of training didn't faze me. I thrived in medical school. It was a recipe I enjoyed and was good at. 1 part class, 2 parts reading, 5 parts studying, half parts sleep, repeat. I ultimately chose family medicine because I found joy in treating families. I love focusing on preventative health, and I was hopeful for a work-life balance. Fast forward 15 years later, I'm in my dream job, but the joy was fading. I was hit hard with the reality of what medicine had become. 12-hour shifts, 36 or more patients a day. I became irritable and emotionally exhausted. I was running on fumes. I relied heavily on caffeine and sugar with little energy left for my family. I definitely was not practicing preventative health in my own life. Instead, my life was becoming more and more physically, mentally, and emotionally draining. Too many taxing withdrawals, and not enough rejuvenating deposits. It was a dark time, but the doctor and me went into clinical mode, and with the symptoms at hand, the diagnosis was no surprise. I was burned out. Burnout is an occupational syndrome resulting from prolonged levels of high stress, leading to decreased effectiveness at work. I quickly realized I was not alone. Burnout can affect anyone. 52% of Americans are burned out, according to Psychology Today. Physician burnout? Yep, it's a thing, and we should all be worried about it. According to Christina Massock of the University of California, Berkeley, the top 3 causes of physician burnout are unsustainable workload. Imagine clinic days, 36 patients, 15 minutes apart, no time to eat, breathe, answer messages, or complete patient charting. Lack of control. Management dictates schedules, limits vacation days. The consequence? Lack of autonomy and sacrifices to my family. And lack of recognition. There is little positive feedback or recognition in today's medical climate. For me, a good day is when a patient extends a rare gesture of gratitude. And there are far-reaching ramifications. Physician burnout has increased since 2021, with 53% of physicians saying they are burned out. 1 in 5 physicians plan to exit medicine within 2 years. And it's predicted we will be short up to 139,000 physicians by 2033. And the Journal of American Medical Association showed that physician burnout is associated with negative clinical outcomes, lower levels of empathy, medication errors, and medical errors. The results: patient safety is threatened, and patient satisfaction is lowered. All this data brings me to the person, the human, the doctor in the center of it all. In this case, it's me. I want to love my job. I want to be enthusiastic, and I want to be present. But I realize the biggest challenge in medicine isn't me. It's a triple aim business model. It has 3 primary areas of focus: enhancing patient care, improving health outcome, and management of costs. Notice, doctors are not a part of this equation. Patients are best served by an expert physician whose compassion, intuition, and humanity are there to provide the best care. Yet the goals, processes, and policies in place to protect the triple aim fail to include the human needs of the ones providing care. Medical care at its core is supposed to be personal, integrative, healing, and restorative. The physician burnout crisis was recognized in May of 2022 when the Surgeon General of the U.S. issued an advisory for the urgent need to support our healthcare workforce. In response, and in isolated places, proactive programs and systems were being put into place to support the doctors and healthcare teams. Vanguard hospitals are leading the way. They were operating under a revised business model called the Quadruple Aim, with the addition of the fourth quadrant, which emphasizes healthcare team well-being. This is the beginning of a sustainable recipe. Also, to ensure healthcare workers and doctors got the support they need, Vanguard Hospitals created a new role, Chief Wellness Officer. This is a physician lead, an administrative role whose goal is to advocate and support for the wellness of those providing care. Such a revised model is a ray of hope, but every medical institution needs to operate under a business model which emphasizes healthcare team well-being and have a tangible structure to make it happen. Leading institutions such as Stanford, Duke, the Mayo Clinic, and the American Medical Association are committed to producing research-based protocols in which healthcare organizations across the country can implement to tackle physician burnout. And just like any treatment plan, there are smaller holistic steps the medical profession can take. Physicians need intellectually stimulating environments, like health policy think tanks, where doctors can exchange ideas and discuss the latest trends in medicine, similar to the structure at the RAND Corporation. Physicians need to cultivate community at work, scheduled social gatherings which bring and build human connection between physicians are critical. Peer relationships make us stronger and remind us we are not alone. And in the words of the Hippocratic Oath, collegiality unites us in preserving the finest traditions of our calling as we experience the joy of healing those who seek our help. And lastly, physicians need to take time off. A third of physicians take no more than 2 weeks vacation a year. Time off is proven to increase well-being, performance, and productivity. Physician burnout is a fixable crisis. I challenge every medical institution to adopt and operate under the Quadruple Aim business model, which holds each organization accountable to create a proactive plan. Remember, your physician is human. A dose of humanity and gratitude will go a long way. Today's recipe for medicine needs to evolve to produce the results everyone is literally hungry for. The missing ingredient? Doctor and healthcare team wellness, on and off the job. I want the same preventative concern and care I give my patients to be prioritized for doctors. I know it can be done. Let's get to it. Keeping my dream alive, bringing the joy back in medicine, and giving you the best health care you deserve. Don't forget, hug your physician today. Thank you.